Hi everyone. Hi everyone. Hello. Hi. Happy Tuesday. Great to have you all here. Hi. Just let me know if you're hearing me and am I clear? So today we have very interesting talk with Dr. Bryce Applebaum. He's a neuro-optometrist and he has a very unique perspective on vision. He's a functional guy. So yeah, that's great. You can hear me. Perfect. Thank you for confirming that. Thanks. So he has a very unique approach to vision. And if you have any questions about eyes, about vision, he's the guy that you want to talk to. If you have any questions, do not hesitate to drop it either in the question bubble or in the comment, and we try to answer as many as possible today. So I'm going to invite him in a second. Hi. Yeah, you can just drop any question if you have about eyes, about vision. He is amazing. He works with lots of kids who are diagnosis of ADD, ADHD, autism spectrum disorder, and dyslexia. Also, he works with athletes. So he's the guy that you want to ask questions about vision and how to look after your vision. Let me just going to invite him. Hi.
Hello, hello. Nice to meet you,
Hello.
Dr. Amin.
Good to have you here, Dr. Bryce. First time I met you or I saw you talk was with Sachin Patel talk, and next one was with JJ Virgin. So
Oh,
I
amazing.
knew that you are very interesting and amazing. So I couldn't wait to have you here and talk to you about what you're doing.
Well, I appreciate you having me on and so much that I love just talking about sharing
That's
because there's so
great.
much unnecessary struggling out there that we can all avoid when we know better so we can do better.
So before we get into the juicy part, let's just introduce yourself to everyone here. I myself interested to know your a little bit about your story, your background, how you ended up here. Neurooptometry, a very interesting specialty. Oops. I think Dr. Bryce is the connection is a little bit tricky. Let's see. Hi.
Hi.
We got disconnected.
Well, we are back here. Absolutely. Love to share all that. Hopefully that doesn't happen again. So I am a neurooptometrist, which basically means I'm board certified in how the brain and eyes are working together as a team. And what we specialize in is something called vision therapy and rehabilitation. So it's kind of like PT for the brain through the eyes, and work with a lot of people with eye turns or lazy eyes as an alternative to surgery to learn how to straighten their eyes. We could talk about why that is and what's involved there. Concussion, traumatic brain injury, where vision is the missing piece so often to getting back to work and to life and to school. A lot of kids with developmental delays impacting reading, learning, and academics. A lot of
Mhm.
athletes, a lot of people who want enhancement and anti-aging and not to have to get stronger glasses every year. And
Mhm.
although we get older, our visual system should not deteriorate as we age. So I got into this space really because I'm a product of the work that we do here. And to save a long story, I'll make it quick. When I was younger, I had visual developmental delays. I had trouble tracking my eyes, focusing my eyes. I had poor depth perception, and I found that I was kind of really stuck, almost like a turtle in his shell, retreating in so many aspects of life. And I attribute all my success in life, athletically, academically, even interpersonally, to what was established for me with vision therapy. And I did a lot of vision therapy. I did sensory integration based occupational therapy, and the two together were a pretty powerful 1-2 punch to the neurological system, so that I could turn this kind of disability or this weakness into a strength to really give me an advantage in the world. And I think what most people don't realize is none of us are born with the ability to track or focus or converge or use our eyes. It comes through our life experiences. It's developed. So it's either developed well or not developed as well as it could be. And that's when some intervention is needed. But especially now, these problems are everywhere because kids are being exposed to screens and technology at earlier ages, and being asked to read before they're visually ready, often in kindergarten. And so gaps emerge between where somebody's functioning and where they could be, and we've got ways to close the gaps.
Mm-hmm. Great. Amazing. So first of all, what is the difference between vision and eyesight? So for example, all of us go once a year to optometrist and get our eyes checked. And I personally come out with a new prescription for my eyes. It takes me a few days to feel better and adjust to the new prescription, some nausea and a little bit of blurry vision, and thereafter I'm good to go. So what's the difference? Or is it the same thing, vision? And you're very functional. So if you just explain in a very simple way,
Yeah.
eyesight.
Well, so first of all, getting glasses that don't seem right and that take adjustments and adapting to get used to them, in my opinion, that's the wrong glasses. And really, that shouldn't be happening unless our brain is having to compensate differently. And really, our prescription should be the weakest lens possible, the most balance between each eye that gives the most improvement to improve performance. And so anytime you're getting glasses and you put them on and you're disoriented or dizzy or it's off, that means go back to the doctor and share that, because we should all be looking for 20 happy, not just 2020. So I love that you bring up eyesight versus vision, because that's a distinction that once you understand that, then a lot of this crazy stuff that I do, but really the functional medicine for vision, makes a lot more sense. So eyesight's the ability to see. That's letters on a chart in an eye exam. For a child to see what the teacher writes on the board in the classroom, or a street sign for an adult when you're driving. And eyesight's really a symptom, and that's what we have glasses for. Vision is far more complex. Vision is how our eyes move together and converge and track and focus and process information, and really how we derive meaning from the world that's around us and then direct the appropriate action. So most doctors are solely focused on just that pursuit of 20/20 eyesight and
Yeah.
making sure the eyes are healthy, which is important, but we got to do testing and evaluation well beyond that to actually look at how the eyes are working as a unit and how well the eyes, brain, and body are working together as a team. So if a doctor tells you you've got perfect eyesight or your eyesight is XYZ, say, great, but now what about my vision? What about how my brain is using that information? Because vision is brain, eyesight is just eyes, and we see through our eyes, not just because of our eyes.
Yes, that's true. So you see a lot of kids and with different diagnoses like ADHD and dyslexia and autism. So they come and they see you. What are the steps that you go through and help these people?
Yeah. So all three of those, ADD, ADHD, dyslexia, they're incomplete diagnoses unless functional vision problems that are often hidden, that cause the exact same symptoms, are ruled out first. Because it's not like there's a blood test you can take to say, yes, you have ADHD, or, you know, the symptoms are so similar and they're so often clouded by just the wrong type of assessment, or looking at behavior and symptoms rather than identifying the root
Mhm.
cause. I mean, I would say 99% of people I work with have difficulty reading words, and dyslexia by definition means difficulty reading words. But there's specific vision problems and diagnoses that make it much harder for the eyes to focus, or much harder for the eyes to converge, or much harder for the brain to process that information, so that when you're trying to read, when you're trying to sustain attention, there's so much extra effort needed that your brain can't possibly even use the eyes or process that information as well as it should or could otherwise. So vision therapy can close that gap in terms of vision development, where somebody's operating and where we want them to be, and so developing the skills that weren't learned naturally on their own. Oftentimes even just the right glasses, whether that's prism or low plus power, something that is therapeutic in nature rather than compensatory, that can dramatically help with the brain's ability to stay focused. And our brain can't stay focused if our eyes can't stay focused. And so a therapeutic lens is really a lens that is not doing the work for you. It's not a crutch, but it's allowing maybe a better opportunity for the eyes to work together, or helping the inside and outside muscles of the eyes work better together in synergy. But I mean, so often, the most common symptoms of that type of profile for a child is somebody who is a reluctant reader or avoid reading, and they want to be read to by their parents, or they're skipping words or losing their place, or, when they're reading, or they're not remembering what they're reading, or they're really squirmy with desk work. And in the classroom, it's as if they're not paying attention, but they're relying on their ears, not their eyes, to take in what the teacher's presenting. And so a child who, can't articulate as well as you or I could how we're feeling, what we're noticing, if certain things we can attend beautifully and for long amounts of time, but then other things like reading and writing and sustained near concentration tasks we can't, that's a pretty clear sign there's something going on that's not allowing the eyes to work together, or the brain to process information as well as it should. And so, a really smart child who's uh, avoiding reading, having frustrations in the classroom, or not really able to demonstrate their strengths or capabilities, that's a almost diagnostic for, yeah, there's probably a visual developmental delay here that's going to be treatable with if we do the right work.
And then how many times we see these people labeled with ADHD or
Yeah,
ADD? I mean, it could be overlap to some extent, but
absolutely.
I mean, what you're doing, you're helping them to become more normal and function better on a daily basis at school, at home, with their friends.
Absolutely. And vision is not everything, but it's a big piece to the puzzle. It's our dominant sensory system. And we see plenty of patients who, they come in, they're told they have AD or ADHD, they're taking medications, it's not really moving the needle much in terms of behaviors. We uncover what's actually happening with the eyes not working well together, and then the symptoms drastically improve to the point where the label no longer exists, or they no longer need meds. That's kind of the best case
Yeah.
scenario. There's other scenarios where you say, okay, well, at least this is the low-hanging fruit that's treatable once it's identified. And then once it's treated, performance is improved and attention is a little better. But yes, there still is a biochemical imbalance, or yes, there still is ADD or ADHD. And then there are some scenarios where vision's perfect, and it's no, we just are having a difficult time attending to anything in life. And that's honestly where you come in with your functional medicine background and supplements and nutrition and lifestyle. And I would argue anybody's diagnosis or inattentive behavior shouldn't define them, but also so much can be done to help elevate performance
Absolutely.
beyond that point.
Yeah, absolutely. So, roughly this process of you seeing these kids, how long it takes and how long they work with you.
Yeah. So vision therapy is not like physical therapy, where for physical therapy, let's say you have a sprained MCL, a sprained knee. If it's grade 1, you need a dozen sessions. If it's grade 2, you need 2 dozen, grade 3, 3 dozen, and it's pretty consistent. There's not really consistency yet on what vision therapy looks like. And so, I think you don't even have to be board certified to offer it. You don't even have to be a doctor to do what's called vision training now. I mean, there's such a massive need that a lot of OTs, PTs, speech therapists, teachers, trainers,
Mm-hmm.
functional neurologists. I mean, lots of people are doing vision work, which I think is great as long as we recognize, there's some limitations there. My practice is in Maryland. I've got an office in Bethesda and Annapolis, which are both about 20, 30 minutes from Washington, D.C. In the D.C. area, there's like 6 or 7 thousand eye doctors, but in all of D.C. and Maryland, there's only 7 of us who are board certified in this specialty, and 2 of the 7 are within my office. So it's a very underserved population, and I would argue the level of care when you see somebody board certified versus when you don't is drastically different in terms of the treatment and kind of the getting us to a better place. Most of our patients who are local, they're here twice a week is kind of our sweet spot, where the days they're in office, they don't have to practice at home. But then we give lots of home reinforcement or exercises to do at home to help allow for muscle memory and to speed up the process. And we're actually just launched a customized virtual reality program for all of our patients, where uh, we're going to be giving a virtual reality headset and have them actually do the programs that we do in office, but to be able to do it from home, to be able to get better results faster. But then we also see a lot of people with what we call an intensive program, or almost like a vision therapy boot camp, where
Mm-hmm.
they'll come in from out of state, and we'll do a consultation ahead of time virtually to make sure it sounds like they're in the right place. But then the evaluation is Monday, follow-up evaluation end of the week on Friday, and then we're doing about a dozen sessions or a dozen hours of work throughout the week,
Mm-hmm.
with then a follow-up home program for about 3 months, where our doctors continue doing virtual work with them and really move forward in a nice way. So we found that for most people with the intensive program, the progress you make in a week is about equivalent to like 3 to 4 months if you were living across the street, let's say. And it's just
That's great.
putting the brain through this massive learning opportunity that it's kind of impossible for it not to respond, especially if the right work is done and the right
Mm-hmm.
problems are identified.
Lovely. That's amazing. Um, Someone was asking about some traditional disease like eye problems like glaucoma. Do you deal with that too? And if these treatments help with glaucoma or cataract or other problems with eye, if that delays the process or reverse it,
Yeah.
any
So definitely, so much of disease, systemically and within the eyes, is in response to our environment and the standard American diet and all the stuff
or the
that's around us that allows.
pollution
Absolutely. And
of
so
things?
taking high levels of antioxidants and tackling the free radicals and oxidative stress that's occurring in the eyes can be massive for improving cataracts, macular degeneration. I mean, certain
Mhm.
things where the eye itself, the structure is being influenced negatively based off of the environment. I would say this type of work doesn't cure, let's say, something like glaucoma. However, with glaucoma, and that's the optic nerve, which is the cable coming out of the back of the eye that connects to the brain that sends the signals. And with glaucoma, it's generally that the pressure in the eye is too high for that person, that
Mhm.
the cable gets squeezed and some of the nerve fibers die off. And so, how that actually matters in life is our peripheral vision starts to become more collapsed. And so, functionally, when the human visual system is under stress, the autonomic nervous system goes into this fight or flight response, and our pupils widen, and we get this tunnel vision effect. And so we can absolutely teach and enhance central and peripheral visual processing. So we can actively open up periphery more. So we can make it so that we can take in what's around us in our visual field much more easily. With glaucoma, though, if there's damage to the cells,
Mhm.
we're kind of artificially having to have the world be more constricted, but we can actively improve functional skills to support activities of daily living, so that when you're walking around a new environment, you don't have to make all these eye movements to take it in. We can actually take in more space with each scan or each change in eye movement. Or navigating through space, often our depth perception gets impacted, and so we can make it so that depth perception is enhanced, so that not only do we know where things are, we can anticipate where they will be
Mhm.
and prepare our bodies to respond. So to really answer your question, I would say in many cases, function is altered after structure is altered. And so with these structural problems, we can absolutely improve quality of life and function for many people,
Mm-hmm.
especially if it's issues with reading or balance or driving or catching a ball or kind of more dynamic changes that are required in life.
That sounds great. So there's so much hope
So
for
much. I mean,
everyone.
I'm of course biased, but this is such a missing piece for so
Yeah.
many people, and there's more of a discrepancy between structure and function with eyes than I think any other part of the body.
Mm-hmm.
And none of this that we do is taught really in school. I mean, it's separate residency and fellowship and all of that. And I think most doctors aren't testing for any of this because they don't know what to look for. And even when they do find what to look for, there's so few people to refer to. It's kind of like, why are we identifying this if we don't even have solutions in place? But the ones that do, I mean, it's a collaborative approach for all healthcare. That's what it should be.
Mm-hmm.
Yet not everybody has that model.
You mentioned antioxidants and supplements. So anything in particular you normally advise people?
Yes, I think to me the two most important supplements for eye health and for brain health are omega-3 fatty acids, which great for brain health, great for eye health, great for the tear film, the outer layer of our front surface of our eye to be more viscous so our own tears don't evaporate as quickly, and it can really help with dry eye
Mm-hmm.
and just irritation. Really high quality is what we want for all supplements, but specifically for omega
Mm-hmm.
threes. We actually have a special omega gummy that we sell in office. Pretty soon we'll be selling it online. That is outstanding. It actually tastes good. It's not fishy. All three of my kids love it, and we actually call it brain candy because
Mm-hmm.
it's candy for the brain to
It
help
is.
the brain, heal itself if it's damaged or just optimize neuronal function. And then the second, I would say that is fantastic in terms of antioxidants or antioxidation is glutathione, and
Mm-hmm.
specifically a compound called glutarol, which is a spray form of glutathione, and we have it on our website as well. It Glutathione levels decrease as we age, and glutathione is our master antioxidant, and it's almost like a recycling truck that goes through and cleans up all the toxins and damaged cells, and
Mm-hmm.
especially with head injury or even just toxicity from our environment. Glutathione that is either liposomal or, if we can, the spray form allows for much faster absorption. And with the glutarol spray form, I think we can get to optimized levels of glutathione systemically within 2 to 3 days, which is
Wow.
crazy.
So
So
spray
those would be the best two.
on skin or spray
So
nasal spray or
So
okay.
this one in particular, spraying on skin. I spent a
Mm-hmm.
lot of time with the scientist who formulated this, who's been studying glutathione for 20 years, Dr. Nayan Patel. He's awesome. He recommends on an area of skin that has as little hair follicles as possible to increase absorption. So I take it and I spray actually on my forearms and then rub them together, which is a little strange to do, but once you do it, I mean, it's awesome. And I twice a day for me, and we have the dosing regimen on our website as well. But glutathione and specifically glutarol is a game changer.
So it's good for everyone as a preventative care and just to take as a supplement to look after for health of vision and
Absolutely,
other things.
absolutely.
So many.
And there's so much that's great for vision. I mean, in terms of antioxidants, vitamins A, C, and E, and lutein and zeaxanthin, and we're actually in the process of formulating our own vision support gummy,
Mm-hmm.
where it's going to be gummy form so that people can enjoy taking it, and it's less pills, but also nothing like this exists. And we're trying to cram in as much as possible in the gummy form and keeping the dose so it's not like you're eating, an entire bag of Swedish fish
Mm-hmm.
in each dose, but that should be out within the next month and a half or so. And that's all about antioxidants and brain and eye health.
So now, what about screen? So screen time, we see not only kids, adults, we are all on the screen 24/7. So you deal with a lot of kids. So what do we do about screen? Any recommendation or advice about the time? What is healthy and not healthy? Of course, I mean, even kids nowadays, homework is on screen. So everything is changed with technology, and so it's an epidemic of screen. So how does that impact our eyesight and vision, and how to use it safely? What are the recommendations?
You're hitting all the important points here. So screen time is the new pandemic. I've been saying this for now, really since COVID. As humans, we're not meant to be staring at screens all day long. And at least in America, the average American spends 7 hours and 4 minutes a day on a screen. That's average,
Yeah.
which means many are way more than that. And if you can think back evolutionarily, I mean, our eye movements were intended to guide movement and to scan the horizon for when the saber-tooth tiger is coming at us so we can run and get out of the way. Yet now we're making these very careful, intricate eye movements on screens for 7+ hours a day for many people. So I am definitely not anti-technology, and I would say our practice has evolved to become incredibly
Mm-hmm.
tech-driven. However, most people don't have the visual skills and abilities in place or the visual foundation in place to thrive in this screen-filled world. So definitely the simplest stuff is taking a lot of breaks. Everyone talks about the 20-20-20 rule these days, which means not more than 20 minutes without taking a break for 20 seconds and looking at something at least 20 feet away. So kind of resting our focusing system, disengaging, and then coming back.
Mm-hmm.
But that's kind of the maximum amount. I mean, as many breaks as we can would be ideal. Dry eye is on a huge increase now because the average person blinks 15 times a minute. When we look on the screen, it goes down to 3 to 5 times a minute, which
Wow.
literally means you're blinking less, you're dispersing fresh new tears less, the windshield wipers are cleaning off the dirt less, and so that sends a signal from the brain to the eyes to release more tears, and they're not in the right consistency, and then your own
Mm-hmm.
tears evaporate, and it's kind of leading to this dry eye disease that is becoming more and more prevalent. Also related to the microbiome and gut health, which you are an absolute expert in. Um, but I would say one of the coolest things or one of the things I'm most proud about is we have an online vision training program called ScreenFit that is intended to develop the visual skills to thrive in this tech-driven world. And it's kind of the equivalent of like doing body weight work at home rather than going to the gym. It's
Mm-hmm.
always more effective to go to a gym, work with a
Yeah.
trainer, use strength, cardio, flexibility, all the stuff, and have it individualized to you. So the
Mm-hmm.
parallel with that is always go to a board certified doctor with an individualized program in office. That's the gold standard that never changes. But not everybody has access to a gym. Not everybody has access to doctors like us. And so we created this right at the beginning of the pandemic to really help establish the right visual skills to minimize symptoms and to promote healthy vision habits
Mm-hmm.
for extended screen use. So almost like a wellness program. So ScreenFit there's 2 different courses. Each course has 30 lessons. Each lesson should take 5 to 15 minutes a day to do. And it's intended to just exercise the eyes and exercise how the eyes are working together. And so far, 100% of people who've gone through this have seen a reduction in symptoms. We've had as young as 5, as old as 89, and
Wow.
we've had massive numbers now. I mean, we've got Marriott offering it to its employees. We're up for a government contract. So this has become a really nice way to just get the ball rolling for many people.
Mm-hmm.
And it's carefully designed so that we can't really make anything worse. But for some people, if there's an eye turn, if there's a massive concussion they're recovering from, or if acuity is way off on one eye and there's a lazy eye and amblyopia, ScreenFit's going to probably help a little, but that's not going to be the solution.
Mm-hmm.
But for many, it makes it so productivity improves, your ability to stare at screens improves, the tech neck that we all have by staring at screens too much gets better. So really nice program at screenfit.com, and I created it so that we could have more access to this type of stuff, and now it's turning into a monster, which is pretty great.
Wow. Wow. Congratulations.
Thank you. It's getting my profession a more firm seat at the medical table, which I really appreciate because now people are recognizing, you know, eyes become damaged from too much screen engagement, and even nearsightedness is now it's increasing at an alarming rate because of the near stress. The symptom is blur in the
Mm-hmm.
distance.
Mm-hmm.
We don't address the problem of the focusing or tracking or eye conversion problem, then the symptom just continues. And so we can actually slow that down and in many cases stop or even reverse it if we're intentional with the right work.
Great. So people can have access to screen fix,
ScreenFit, yes, just screenfit.com.
screen fix.
Simple, easy, and I think there's even some free demos on there, and we have a quiz that's about to go up on there. But it's a nice way to just to start being more proactive with training our brain and our eyes to work more efficiently together.
And so there are some exercises people practice. You mentioned about dry eye, of course, and any recommendation on drops? Do you, because so many of these tear drops have so much
Yeah.
preservatives. I use them myself, and it's worse. It makes me worse, irritate my eyes. So any specific recommendations? Do you have any eye drops
So
that
I
people can?
don't have eye drops yet. I mean, I would say for almost every patient that my practice has worked with, omega-3s help the tear film and help dryness. For many people,
Okay.
it's all they need.
That's
So if we can look at the tear film as kind of like your grass, if you're always watering your grass, it's going to be greener and healthier, but that's kind of like the tears. If you're always putting tears in, not just when it's irritated, but preventatively, you're going to have better grass. But if you're addressing the fertilizer as well, and if the omega-3 is addressing the tear quality as well and decreasing some of the inflammation that's occurring with the lids and the front surface, then that's going to help. As silly as this sounds, remembering to blink. I mean, I have a lot of patients who have an alert on their computer or timer on their phone that just like annoys them to
Yeah.
blink and to look away. But if you're so locked in with back-to-back Zoom meetings or work that you're doing, you forget to blink, you forget to look away, as crazy as that sounds. So I think that's important. But like you said, with eye drops, preservative free, absolutely. But if we can really hit this systemically and have as much of an anti-inflammatory diet as possible, that alone is going to help the tear film more than any drops would.
Right. Someone is saying Dr. Applebaum made my son's dream of being a pilot a reality. Oh, that's so
Oh,
sweet.
amazing.
Ah,
That's so nice to hear. I mean, there's some I mean, so much of that in life is based off of what our vision can and can't do, and especially for pilots, very strict guidelines. I mean, you have to have it's the cream of the crop, especially in the Navy and armed forces. So you need depth perception, you need the eyes working together, you need to see a certain level, and if we catch things early enough, we can massively improve where we're functioning with all aspects of health.
um, so a little bit you mentioned about acute brain injury, trauma, neuroinflammation. So you deal with that. I mean, we do have here in Canada, in Toronto, some clinics, rehab clinics. How do you work with these people? First of all, what is this neuroinflammation? How does it impact vision? And
Yeah. So I love that you said vision and not eyesight, because remember, they're separate. And
yeah.
vision, we have more areas of our brain dedicated to processing vision than all of our other senses combined. So it's kind of impossible to have a head injury and not have vision be involved. It's just a matter of at what level. And what typically occurs when that happens is we start to get dizziness and nausea and vertigo and blurred vision, and environments with lots of sensory input or with busy, crowded peripheries make it so we get this like sensory overload and almost want to retreat and get out of there because your brain can't filter and process all that input. So what something like vision therapy can offer is an ability to tie together visual input with vestibular input. And our vestibular system is our kind of internal GPS system in the roadmap of life that lets us know which way is up and down and left and right. And literally recalibrating the brain and establishing neurons that fire together and then wire together can allow for order to be established from previous chaos or disorder. And the light sensitivity and the disrupted sleep and all of the challenges that occur after the autonomic nervous system goes into this imbalance. Obviously you're addressing it ideally from a systemic standpoint as well, but vision can, in many cases, be completely rewired. And the ability to use the inside and outside muscles of the eyes in synergy can be reestablished with the right intention and the right program.
Someone is asking about light therapy. red light therapy. You do that in your practice too with
Yeah,
patients.
photobiomodulation or red light therapy
Hmm.
can be wonderful for powering up our mitochondria and for healing and for skin health and for the
Yeah.
eyes as well. But what's really neat with neurooptometrists is we also do something called phototherapy or syntonics, which is using light to activate certain cortical or brain areas
Hmm.
in ways that they weren't. And so that's as simple as looking into a machine that has certain carefully picked out wavelengths of light. So certain wavelengths stimulate parasympathetic innervation, certain stimulate sympathetic. Certain ones are great for people who don't have language centers communicating
Hmm.
with auditory centers. So there's really strict kind of protocols for that, but also that's a great thing that can be done at home as well, where we can give certain glasses that have certain wavelengths or lights on them that you wear as you go outside, let's say. So,
So
an
according
example here,
to your needs and where you want to get activate or
absolutely. So this is alpha delta, which is kind of a reddish light. This would be, we'd give this to a patient who's got, let's say, who are looking for more sympathetic tone. And
Mhm.
we're saying, go outside, hang out in your backyard, go on a walk, but wear these so that everything that is being received through the eyes is within a certain wavelength and blocking other
I
wavelengths.
see.
And I can literally count on two hands the amount of children in particular on the autism spectrum who had not developed language before, who said their first words in our office while wearing glasses like these that are literally waking up areas of their brain.
Mhm.
And it's a very underrepresented kind of subspecialty within eye care, but I mean, light is everything.
It-
Light regulates our circadian rhythms and it keeps
Yes,
us alive and growth. And I mean,
yes.
yeah. So there's
Sleep, stress, everything.
a lot we can do to maximize that.
Yes. Very interesting. So one last question. A lot of followers or viewers here are women, and they are obviously worried about the eye health and makeup. So
Yes,
maybe
yes,
recommendation.
yes.
So makeups, what to avoid these makeups, of course, and which is danger to our eyes and health of our
So,
vision.
so my public service announcement is definitely for the lashes. There's lots of different lash extension products out
Mhm.
there, many of which have chemicals or medications in them whose side effects are increased pigmentation of the lid or lashes. And there's specific glaucoma medications which do a great job of lowering the eye pressure but then allow for increased pigmentation on the iris or the colored portion of the eye or other areas of your eye that cosmetic companies have then taken small doses of that, applied it to makeup to then allow for thicker, fuller lashes. And so you want to be really careful, always read the ingredients
Mhm.
with anything you're putting in or on your body. But specifically for makeup, I mean, there's lots of natural makeup out there. There's lots of preservative-free makeup out there. You want to clean the makeup brushes as much as you can. There's certain allergic reactions that many women have to certain melanin or pigmented colors. Purple is actually pretty commonly causing irritation for many people. And so, I think keeping the eyes clean, keeping the brushes clean, keeping the hands clean is going to drastically decrease the chance for bad stuff happening.
Mhm.
But maybe you want to create a makeup line together, and then we can have it to benefit from
I'm
vision. And
interested. Yes,
okay,
definitely. Let's do
I
it.
haven't thought
Our
about that. Let's talk
next
after
niche.
this. Yes, yes, I love that.
Great. That's so good. So just let us know where people can find you, and do you see patients or clients internationally, especially here from Canada. We do have a lot of people interested. So where can they find you and you see them too?
Yeah, so actually, it's crazy. We see so many people who come to us for intensive programs from social media and even just reels we're putting out on Instagram, which is
Mhm, mhm.
crazy to think about because a decade ago that was not the case. But practice and everything we do is under the umbrella of myvisionfirst.com. And we're about to launch a really robust shop page with a lot of different products and things that we offer, sell, recommend, and even some digital performance lenses, so glasses that kind of protect our eyes and our brains from extended screen use. So that will be up in the next couple months as well. But you go to myvisionfirst.com, that's how you can kind of access everything that we're doing. Screenfit.com is a wonderful place for that kind of online vision training program we spoke about. And then social media, we're trying to be everywhere and just raise awareness. I mean, there's so many people struggling unnecessarily because of these hidden, misdiagnosed vision problems, or even just missed opportunities. Our average patient has seen 4.5 eye doctors looking for a solution before they come to us.
Wow.
So we're now limiting how many patients we see a week from out of state because of this kind of VIP program that we're offering. We want to make sure that, it's not disrupting our local patients, but also that the return on the effort and the investment is well worth it, and hopefully we're 10x what it actually costs. So a lot we can do to help, and just recognize if there's eye strain, if there's fatigue, if there's performance limited, or if we're having difficulty with vision guiding and leading, don't accept status quo, and always ask your doctor about your vision, not just your eyesight.
So it's just amazing, extraordinary what you're doing.
Thank you so much, and
It's
appreciate
so
you having
good.
me on.
And of course, we will follow you and your social media and website, and we'll be in touch.
Thank you. Start thinking of a name for our cosmetic brand.
Will do, sure.
Awesome.
We'll be in touch shortly.
Good. Have a great rest of the day.
You too. Take care. Bye-bye.
Bye.